it's time for Taking the Mic. Now, there can't be many people who didn't wince slightly when they heard the news today about the Princess of Wales and the health problems that are going to keep her out of action and out of the public eye for the best part of the next 2 months. The news about her abdominal surgery will elicit a good deal of sympathy, and so it should. After all, she's still a young mother, and she is to be the Queen of the United Kingdom of Great Britain and Northern Ireland at some point in our futures. Then we were told of an even more shocking revelation about her father-in-law, King Charles, who will likely spend a night in hospital next week as he receives a corrective procedure to treat an enlarged prostate. Men of a certain age will know exactly what that is like. And indeed, prostate cancer charities are already praising him for raising awareness for men to get themselves checked. For Kate, she will be receiving the very best of care at the London clinic, and that is as it should be. Here at the Independent Republic, we wish her all the best for a speedy recovery. And I'm certainly not one of those that will demand to know every detail of what is clearly a private matter. The King similarly will be treated by the very best doctors that money can buy. Not for either of them the uncertainty of being treated on the beleaguered NHS. Not for them the inconvenience of having procedures cancelled, postponed, or simply forgotten about. I was struck by the contrast of what we would be reporting on if there was only one health system in this country, take it or leave it, if there were striking doctors affecting what outcomes these two senior royals might expect, and if shortages of drugs and other medicines might affect how quickly they might recover. And then I read the experiences of our current Health Secretary, Victoria Atkins, today. She was speaking at the Women's Health Summit about what she went through while trying to give birth to a son. She described the NHS ward where she was taken with pregnancy complications like one of the dark corners of the health service. She talked of new mothers suffering hellish agony, and in pledging to improve maternity care in the NHS, she says it is a top priority to ensure that others do not face the fear that she faced. She talked of how unprepared the hospital was to deal with a woman with pregnancy complications, and her story will be a familiar one to anyone who spent time in an NHS hospital in the last 5 years. Our nation has begun to admit that our health service isn't the best in the world. It's very far from it. But isn't it time the NHS itself began to fix itself? Perhaps if more politicians were forced to use the NHS, it might get better a whole lot quicker.